Hello everyone, this is Nurse Marion. Welcome back to our daily health tips. Today, we're going to talk about something I see all the time in clinical practice, vitamin D deficiency. It's far more common than most people realize, and it affects much more than just your bones. Vitamin D is one of the most important nutrients in the body. It plays a role in immune function, inflammation control, muscle strength, and even mood regulation. Some research suggests vitamin D influences the activity of a large number of genes, which helps explain why low levels can affect so many systems. Here's the reality. A large portion of the population has vitamin D levels below what many experts consider optimal. And the standard guideline of 600 IUs per day was originally designed to prevent rickets and support basic bone health, not the broader functions we're learning about today. So when we talk about vitamin D for immune support, inflammation, or chronic health conditions, those older guidelines don't always reflect the full picture. There are several reasons vitamin D deficiency is so widespread. Staying indoors, living in northern climates, darker skin tones, aging, lifestyle factors, and genetics. Melanin, the pigment that gives skin its color, reduces the skin's ability to make vitamin D from sunlight. That means individuals with darker skin often need more sun exposure to produce the same amount of vitamin D as someone with lighter skin. Low vitamin D can show up in ways people don't always connect to a nutrient deficiency. Low back pain, high blood pressure, obesity, depression, anxiety, increased inflammation, poor immune function. These symptoms can have many causes, but vitamin D deficiency is one factor we always consider, especially when someone has several of these issues at once. Vitamin D deficiency is common worldwide. Many people fall below 30 nanograms per milliliter and some below 20 nanograms per milliliter. However, the claim that over 90% of the population is below 40 nanograms per milliliter varies by region, age, ethnicity, and lifestyle. Some studies show high deficiency rates, especially in dark-skinned individuals, people living in northern climates, older adults, and people who spend most time indoors. But the exact percentage depends on the population being studied. So, where can you get more vitamin D? Sunlight is the most natural source, but relying on it isn't always possible or safe for everyone. Diet plays a role too, though it can be difficult to get enough from food alone. Fatty fish like salmon and mackerel, egg yolks, and fortified foods like milk and cereals are good options. However, even with a perfect diet, many people still fall short. This is where supplementation and testing become crucial. The only way to know your status for sure is a simple blood test. Don't guess test. Once you know your levels, work with your healthcare provider to find the right supplement dose for you. Taking charge of your vitamin D levels can have a profound impact on your overall health. Why high doses must be supervised. Some autoimmune patients are prescribed higher doses, like 2,000 to 10,000 IU daily or intermittent high-dose therapy, but only under medical supervision. This is because vitamin D is fat-soluble. Excess can cause high calcium levels. High calcium can damage kidneys, heart, and blood vessels. Taking a vitamin D supplement or a multivitamin with vitamin D may help improve bone health. The recommended daily amount of vitamin D is 400 international units for children up to age 12 months, 600 IU for people ages 1 to 70 years, and 800 IU for people over 70 years. So even if someone has an autoimmune condition, taking high-dose vitamin D without testing can be unsafe. Vitamin D resistance in autoimmune disease. Some research suggests that chronic inflammation may contribute to vitamin D resistance, meaning the body needs more vitamin D to achieve the same biological effect. But this is still an emerging area of study, and it does not translate into a specific recommended dose. Magnesium's role. Magnesium is required for vitamin D activation. Low magnesium can make vitamin D supplementation less effective, and magnesium deficiency is common in people with chronic illness. Again, this doesn't change the recommended dose. It just means magnesium status matters. Nutrition labels now list the vitamin D content of many foods. Focus on eating vitamin D-rich foods, such as fatty fish, sun-dried mushrooms, fortified milk, or other fortified foods. If you don't eat enough of these foods, a vitamin D supplement may be helpful. Medication interactions. Possible interactions include aluminum. Taking vitamin D and phosphate binders that have aluminum might cause harmful levels of aluminum in people with kidney failure. Phosphate binders treat high blood levels of phosphate in people with long-time kidney disease. Anticonvulsants. The anticonvulsant medicines phenobarbital, Sezabay, and phenytoin, dilantin, Phenytec, break down more vitamin D. This lessens how well the body can take in calcium. Atorvastatin, Lipitor. Taking vitamin D may affect the way the body uses this cholesterol medicine. Calcipotriene, Dovanex, Sorolux. Don't take vitamin D with this psoriasis medicine. Mixing the two might raise the risk of having too much calcium in the blood, called hypercalcemia. Cholestyramine, Prevolite, Localest. Taking vitamin D with this cholesterol-lowering medicine can lower how much vitamin D the body takes in. Cytochrome P450 3A4 substrates, also called CYP4 substrates. Use vitamin D with care if you take a medicine affected by these enzymes. One such medicine is the cholesterol-lowering medicine lovastatin, Altoprev. Digoxin, Lanoxin. Don't take high doses of vitamin D with this heart medicine. High doses of vitamin D can cause too much calcium in the blood, called hypercalcemia. Hypercalcemia raises the risk of fatal heart conditions with digoxin, diltiazem, cardizem, Tiazac, others. Don't take high doses of vitamin D with this blood pressure medicine. High doses of vitamin D can cause too much calcium in the blood, called hypercalcemia. Hypercalcemia may keep the medicine from working as it should. Orlistat, Xenical, Ali. Taking this weight loss medicine can lower how much vitamin D the body takes in. Thiazide diuretics. Taking these blood pressure medicines with vitamin D raises the risk of too much calcium in the blood, called hypercalcemia. Steroids. Taking steroid medicines such as prednisone can keep the body from taking in calcium and affect how the body uses vitamin D. Stimulant laxatives. Long-term use of high doses of stimulant laxatives can lessen how much vitamin D and calcium the body takes in. Verapamil, Verilin. Taking high doses of vitamin D with this blood pressure medicine can cause too much calcium in the blood, called hypercalcemia. High doses of vitamin D also might keep verapamil from working as well. Vitamin D isn't a magic cure, but it is a foundational nutrient. When levels are low, the body simply doesn't function at its best. And because deficiency is so common, it's something worth paying attention to. The safest and most accurate way to understand your vitamin D status is through a simple blood test. From there, a healthcare provider can help determine what level is appropriate for you. Vitamin D plays a much bigger role in health than most people realize. Understanding your levels and knowing the factors that influence them is an important step in supporting your overall well-being. If you found this helpful, go ahead and like this video, subscribe, and share it with someone who might benefit. And as always, take good care of yourself. Please note, this content is for informational purposes only and does not constitute medical advice. Always consult your healthcare provider.